To use the LifePak 12 defibrillator monitor in manual mode, it is important to know if your defibrillator is configured to power on in advisory or manual mode.
Connect electrode.
If the defibrillator powers on in advisory mode, access to manual mode may be restricted. It is important that you are familiar with and understand the power-on defaults set on your particular defibrillator. Defibrillation is used by healthcare providers trained in arrhythmia recognition and treatment to treat life-threatening arrhythmias such as ventricular fibrillation. Synchronized mode is used to treat supraventricular tachycardia, atrial flutter, atrial fibrillation, and some ventricular tachycardias. Defibrillation is not indicated in the treatment of pulseless electrical activity such as idioventricular or ventricular escape rhythms and in the treatment of asystole. To defibrillate a patient using manual mode, power on the defibrillator, expose the patient's chest, and prep the skin for therapy electrode placement. Apply the electrodes in the anterior lateral position. Connect the therapy electrodes to the therapy cable. Confirm the ECG rhythm. Check that paddle's lead is selected. If not, select paddle's lead or apply ECG leads. Confirm the appropriate energy is selected or select energy per your local protocol.
Clear.
State that you are charging the defibrillator and press charge. The defibrillator charges, gives an alert tone when full charge is reached, and displays the message to push the shock button.
I'm clear, you're clear, everybody's
Firmly
clear.
state to clear the patient and check that the
Shocking.
area is cleared. Then press shock. Reassess the patient and the ECG rhythm. If the ECG rhythm is unchanged, select the desired energy. Repeat the charge and discharge sequences according to your local protocol. To perform synchronized cardioversion, prepare the patient for the procedure according to your local protocol. Connect the patient to the ECG electrodes and cable as previously described in this video. Select the ECG lead with the greatest QRS amplitude or height. Press sync. Sense markers should appear on the R wave and the sync LED flashes with each detection. Prep the patient's skin and apply the therapy electrodes in the anterior lateral or anterior posterior position. For cardioversion of atrial arrhythmias, one of two alternatives for anterior posterior placement is shown here. Place the apex electrode over the left precordium with the upper edge of the electrode below the nipple. Place the other electrode on the patient's back, to the right of the spine and below the scapula. Select the appropriate energy. Charge the defibrillator and proceed as previously described for manual defibrillation.
I'm clear, you're clear.
Discharge the
All clear.
defibrillator by pressing and holding the shock button until the discharge occurs. Assess the patient and the ECG rhythm after the shock. If the arrhythmia persists, select energy according to your local protocol. If your defibrillator is configured to automatically return to asynchronous mode following a shock, press sync again. Repeat the charging and discharging
I'm
sequence.
clear, you're clear. We're all clear.
You can remove an unwanted charge at any time by pressing the selector. The energy is removed internally. The charged defibrillator also disarms automatically if shock is not pressed within 60 seconds, if the electrodes or cable become detached, or if energy select is pressed. Press charge again to recharge the defibrillator. During sync cardioversion, the sense markers should appear near the middle or peak of the patient's QRS. If sense markers do not appear, are near the end of the QRS complex or on the T wave, decrease ECG size to the minimum and then increase until they are placed correctly. Alternatively, select another lead. This concludes the manual defibrillation and synchronized cardioversion section of this video. Non-invasive pacing is a means of treating symptomatic bradycardia and asystole. Conscious patients may require sedation to tolerate the pacing current. To pace a patient, power on the LifePak 12 pacemaker, prep the skin, connect the ECG cable and electrodes, placing the electrodes well away from the therapy electrodes, and apply the therapy electrodes in the anterior lateral or anterior posterior positions. Press pacer. Confirm that the LED lights and that the sense markers appear and are properly positioned on the patient's beats. The demand pacing menu also appears. Select the desired pacing rate by pressing the rate button or rotating the selector. Increase current by pressing the current button or rotating the selector. Slowly increase the current until electrical capture is achieved. Look for a wide QRS and a broad T wave following the pace markers. Assess for mechanical capture by palpating the patient's pulse and checking blood pressure. To interrupt pacing and view the patient's intrinsic rhythm, press and hold pause. The pacer will pace at 25% of the set rate. Release pause to resume pacing. To stop pacing, reduce current to 0 or press pacer. If defibrillation becomes necessary, press energy select or charge. Pacing automatically stops. Pacing therapy stops if the pacing cable or therapy electrodes disconnect. A message and alarm tone sound. After the electrodes are reconnected, the alarm silences, and the status message indicates pacer off and current is 0. If current is not increased within 20 seconds, the alarm repeats, reminding you to increase current. Increase current to resume pacing. ECG distortion during pacing, as seen on this trace, may occur because the ECG electrodes pick up pacing current. This may be mistaken by the operator as electrical capture. ECG distortion lacks the tall, broad T wave seen with electrical capture and is not accompanied by a palpable pulse. If distortion is observed, change to another ECG lead or prep the skin and reapply the ECG electrodes away from the pacing electrodes. Always assess the patient for mechanical capture. If the monitor detects an ECG lead-off condition during pacing, the ECG trace becomes a dashed line and an alert tone sounds. Pacing therapy continues as a status message indicates, but at a fixed rate, regardless of the patient's own rate. Replacing the ECG lead restores the trace and clears the alarm. This concludes the non-invasive pacing section of this video.